Good afternoon. My name is Sandra Reese, and I'm the Associate Director of the Minnesota Council of Nonprofits. I want to welcome you to this webinar hosted by the Minnesota Council of Nonprofits and presented by MNsure. While many of you may be familiar with the Council of Nonprofits, some of you might not be. The Minnesota Council of Nonprofits, also known as MCN, was formed 25 years ago to inform, promote, connect, and strengthen individual nonprofits and the nonprofit sector. We have over 2,000 nonprofit members from throughout the United States, or from throughout Minnesota, which makes us the largest state association of nonprofits in the U.S. Through MCN, nonprofits join together across interest areas to work on issues of common concern to all. MCN accomplishes our mission in 4 ways: by providing education and professional development for nonprofit managers and leaders, by offering cost-saving product partnerships, by conducting research on nonprofit sector trends and tax and budget issues, and by advocating on behalf of Minnesota nonprofits at local, state, and federal levels. I encourage you to learn more about the Council of Nonprofits on our website at www.minnesotanonprofits.org. Today's webinar is just one example of the many ways that MCN informs, promotes, connects, and strengthens individual nonprofits in the nonprofit sector. When we learned of MNsure's goals to work with trusted nonprofits and other community organizations to provide consumer assistance and community outreach and education, we wanted to provide a venue for these organizations to learn more about these efforts and the funding available to support them. Certainly there is a desire to learn more about this in the nonprofit sector. Nearly 400 people registered for today's webinar. I will soon turn over the line to MNsure's David Van Sant. But before we get started, there are a couple of housekeeping items to mention. First, you currently should be able to see a slide on your computer screen with the title of today's webinar. If you don't, or if you have any problem during today's webinar, please dial Start Meetings toll-free support line for assistance. That number is 1-800-644-9070. I'll say that one more time, 1-800-644-9070. That number is also listed in the instructional email that was sent to you yesterday. In order to ensure good sound quality for the recording and to eliminate background noise, we have muted the phone lines. But we do want you to ask questions. In fact, a large portion of the time we have today has been set aside for questions. The way to ask questions is by using the chat box on the side of your screen. Please send us your questions via this chat box at any time during the presentation. Keep in mind that all participants can see all items submitted through the chat. MCN and MNsure staff will be reviewing questions as they come in, and we will address as many as we can during the allotted time. I want to reiterate to you, to use the chat, you will need to expand the chat window. So if beside the word chat you see a plus sign, you need to click on that plus sign so that the window expands. Also, we will get to all of the questions today. We will either address them all on this call, or the MNsure staff will post the answers online. So if you've noticed your question has already been submitted via chat, there's no need to send that question in again. So now I would like to introduce David Van Sant to you. David Van Sant is the Navigator Broker Manager for MNsure. He joined MNsure in September of 2012, and prior to that worked for the Minnesota Department of Human Services. At DHS, he specifically worked in the Minnesota Community Application Agent Program, also known as MNCA, and thus has been working closely with community partners since 2010. David has a bachelor's degree from the University of Wisconsin-Madison and a master's degree from Hamline University. David, thank you for being here today to share about the ways that MNsure would like to partner with community organizations for consumer assistance and community outreach and education. On to you.
All right. Thank you, Sandra, and thank you, MCN, for hosting today. We're really excited to be able to have this webinar with those interested in MNsure and our Consumer Assistance Network. With that, we'll get started, and move on to slide 2. This is how today's session will work, as Sandra already spoke about a bit. We'll have online content available. There will be a Q&A via chat, and everything will be viewable later. We'll post links on our website at MNsure as well as MCN to be sure. So, today's agenda. The purpose of today's webinar is really to focus on the consumer assistance partners for MNsure. If you're interested in more detailed information about the broker role and how to become a MNsure certified broker, you can check our website and submit a non-binding notice of intent. MNsure will then be providing additional information to those interested in that role soon. Today's event, the webinar, is going to provide a MNsure overview with a focus on the consumer assistance partners. We're going to talk about partnering with MNsure, the duties and responsibilities of the consumer assistance partners, consumer assister partner application. We're going to provide an overview of the Outreach and In-Person Assister Infrastructure Grant RFP, and then we'll be doing that Q&A Sandra spoke about. First set of slides here then are an overview of MNsure. MNsure is a marketplace for consumers to compare, choose, and enroll in quality healthcare coverage. MNsure is also the place for individuals to see if they or anyone in their household qualify for financial assistance or public health care programs, otherwise known as insurance affordability programs. Individuals, families, and small businesses who need quality, affordable health coverage will be able to get it through this new online marketplace. So what's the value of Minnesota creating its own marketplace? MNsure is really being built by Minnesotans for Minnesotans. It's a one-stop shop with choice, lower cost options, and quality comparisons of available healthcare coverage. But what about help for consumers? That's what we're all here today to learn about. We're going to have a MNsure contact center, and we're also going to have a consumer assistance program. But before we get to that, sorry, just noticed I didn't click through on these slides. Give you a moment to look at that, value of MNsure. A good moment to mention that the slides will be available for download later on, so I'll move on so we can get to the rest of the presentation. So what kind of plans are going to be available in MNsure? There's going to be qualified health plans, they're called. They're offered by an issuer that is licensed by Minnesota and is in good standing, covers essential health benefits, offers at least one plan at the silver level and one at the gold, agrees to charge the same premium rate whether offered through MNsure or outside the marketplace. And this is the type of information that consumer assistance partners will learn more about in training later this summer, so you can help Minnesotans understand their options as they use MNsure for the first time. MNsure is projected to serve many Minnesotans. These are just some of the projections through 2016. Again, what's the value of MNsure and a Minnesota-built marketplace for healthcare coverage? Insurance companies compete for your business, reduce your costs through tax credits, and offer choice of plans and levels of coverage. It's a cyclical process that's going to work to improve the healthcare coverage options for Minnesotans. And how will MNsure offer that value? This is where all the consumer assistance partners are going to come into play. With the help of these partners, we're going to serve Minnesotans through a website, toll-free call center, and through the consumer assistance partners. All right, so here's a glance into the next steps. This is a lot of the work we'll be doing this summer to get MNsure ready to go for October 1st. The state has been working hard since 2010 to lay the groundwork for this marketplace, and MNsure staff are now working very hard on the items you see on the slide. Minnesota legislation was only fully authorized in March, and we've had since April really to develop a consumer assistance program. We spent April hard on discovery and legal rules, We've spent May working even harder on the solicitations, which have been now published. And at the same time, we've been working on developing our operations, the technology, and other aspects of MNsure related to the consumer assistance programs, including training. Now that it's mid-June, we still have a lot to do, and MNsure is looking to the strong community of Minnesota service organizations and nonprofits to come together and create a consumer assistance network. We're really going to build this network together. MNsure is developing its consumer assistance programs and outreach strategies to really supplement and complement the efforts of stakeholders and partners, and ultimately the communities MNsure will serve. That being said, the next set of slides are going to provide some detail on what it means to partner with MNsure. I'm not clicking through. Okay. Little delay there. All right. Partnering with MNsure. Agents and brokers are going to continue to play a role in the marketplace, and MNsure anticipates that many agents and brokers will sell using this new marketplace. But for those consumer assistance organizations, those nonprofits out there doing this work or interested in doing this work of consumer assistance and aren't agents and brokers, they can play these roles created by the Affordable Care Act, which MNsure will be defining for Minnesota. We're going to have navigators, in-person assisters, and certified application counselors. Each of these roles will offer application assistance to consumers. Navigators and in-person assisters will also be doing enrollment assistance along with some other duties and responsibilities, which we'll get to soon. At this point, navigators will receive $25 per successful enrollment into a health plan, while in-person assisters will receive $70 per enrollment into a health plan. Certified application counselors will have no direct compensation from MNsure for this work. We have this slide in here just for emphasis. As you saw with the funding, it's different for navigators and in-person assisters, but the roles and responsibilities are the same, as will be the training. So we're really looking for organizations to serve as both navigators and in-person assisters. We're encouraging interested organizations to fulfill both roles for the population they serve. That way, no matter what enrollment results from the assistance provided to the consumer, the organization will receive compensation for their work. A few things about partnering with MNsure. We're really looking to foster a network of partners throughout Minnesota. We're going to be serving communities through the consumer assistance programs. And these consumer assistance partners are going to use their organizational expertise to serve their own communities. Individuals are going to work for these consumer assistance partners, and it's these organizations that are going to manage these individually certified assisters. Through this network of statewide coverage, MNsure is expecting that referral relationships will be built. We'll also be using the contact center as a resource for referrals, and there will be a directory available on our website to find consumer assistance partners. MNsure is new, and we're looking for innovation. We're not looking to recreate the status quo. We also know that our broad statewide needs, specifically around the uninsured and underinsured, this we hope to post more information about on our website soon for those interested in completing a proposal in response to our RFP. So what are the duties and responsibilities of these contracted consumer assistance partners? Here's a table of the duties and responsibilities for each of these three consumer assistance partners. These will be outlined in more detail in the contracts, and a lot more information is going to be provided in the training MNsure is going to offer this summer for consumer assistance partners as part of their certification. There's application assistance, enrollment assistance, again, for the navigator and in-person assisters, but not certified application counselors. This is also about providing impartial information to consumers. We're expecting referrals between organizations and outside this network to make sure the needs of consumers are met. We're also expecting accessibility. This will be written into the contract in a requirement of our partners to make their service available to those who need it, regardless of their circumstances. Also, there'll be a MNsure directory, and that we're looking to have for navigators and in-person assisters, but certified application counselors may not be on there. But this is a moving target as well. As I said earlier in the webinar, we're still working on a lot of details, so some of these things may change as we go through. We will communicate about it if it does. So now we just have a few scenarios to go through as an example of how this process will work. These are very simple scenarios with not a lot of detail. Again, we're working on some of that detail, but wanted to give examples for those interested. The first step here would be an individual filling out an application. Perhaps they're not sure about a question they see on the application, and they call our contact center. The contact center answers what questions they can, but realize that the individual could use more information and some in-person assistance. The contact center will then refer the individual to a consumer assistance partner who would help with the application and enroll individuals into a program. Scenario 2 is similar. Individual filling out an application. Perhaps they go to a consumer assistance partner based on the directory. They found them on our website and are looking for help. They get help on the application, but when it comes to enrollment in a QHP, they're just not sure which plan works best for them. The consumer assistance partner might help them with the tools available on our website to inform them of their options. But if they'd like more help, they can always be referred to a broker for help with selection and enrollment. Again, we'll get right to that enrollment. Scenario 3, certified application counselors working with an individual in their office. Perhaps it's at a hospital. They're doing the application and have completed it, but the individual has more questions about enrollment. That certified application counselor could then refer the individual to a navigator or in-person assister for help on the enrollment. And again, we'll get to the enrollment through MNsure. All right. Oops, skipped a slide there. So how do you become a MNsure consumer assistance partner? We have an application available on our website at MNsure.org. The application is for our consumer assistance partners, not the notice of intent. Notice of intents are there for brokers or broker agents, insurance producers interested in being certified to sell a MNsure. If you're interested in becoming a navigator, in-person assister, or certified application counselor, you can complete our application, which is a fillable PDF. This is what it looks like. If your organization is considering applying to become a navigator or in-person assister, MNsure encourages you to do both. The roles are identical, and in this way your organization is compensated for assisting a consumer, no matter what type of health care coverage that consumer is eligible for. This is the timeline that we're looking at this point. We've published the solicitation. Applications to play these roles will be due on July 19th. We expect that partnerships will be formalized by August 23rd, and that training will be available in August and September. This will set us up for services available October 1st. Now I'll talk about the grant opportunity for those interested in additional efforts to work with MNsure on outreach to optimize MNsure enrollment. This is a snapshot of key information about the outreach and in-person assister infrastructure grants. There's up to $4 million available in year one. For individual entities, the award size can be between $2,000 and $200,000. For a coalition of organizations interested in receiving an outreach grant, the available funds are up to $500,000. The contract time period will run through September 2014, and the applications for these funding is due July 19th. We are working towards an August 23rd date of announcing awards and formalizing partnerships. Our outreach goals are simple, especially when it comes to proposals from potential grantees. We'd like to know who your organization serves. We'd like you to explain how you will provide outreach to that community in a way that links directly to successful enrollment through MNsure. MNsure is seeking innovative ideas that can be implemented in coordination with our statewide marketing and outreach efforts. MNsure outreach strategies are being built to supplement and complement the community outreach we fund through these grants. This funding opportunity is also available to organizations serving as in-person assisters to build or improve organizational capacity and infrastructure to provide application and enrollment assistance. Here's a snapshot of the 3 options organizations have when submitting a proposal to MNsure under the Outreach and In-Person Assister Infrastructure Grants. Your organization could apply for an outreach grant only. It also could apply for infrastructure funds only. Or it could send a proposal, a combined proposal, to do both outreach activities and receive funding for infrastructure in providing in-person assistance services. So who's eligible for this grant funding? Both entities and coalitions. The details in the RFP, and it explains what type of organizations are eligible to submit a proposal. We'll emphasize here that only one application can be received per organization. To clarify, if your organization is submitting a proposal as part of a coalition, you may not submit a separate application on your own. The application form and format. For the grant proposal, we have application forms available on our website. Be sure to compile your application in the order that it's listed on our website and follow all the guidelines outlined in the grant application instructions. The application forms include the face page, table of contents, executive summary, description of applicant entity, key personnel, consolidated budget summary, resources, and project overview. Within that project overview, MNsure is looking for a description and approach for your outreach activities or infrastructure build, an explanation of your organization's experience or that combined experience of the coalition, the target populations or geographic areas that your organization or coalition will be focusing on, the type of engagement strategies you're proposing to MNsure, and also, if it's a coalition, that coalition and contractual agreement. Here again is what some of those forms look like. Form A is the face page. Form B is a list of performance sites. There's only space available for 4 sites. If you would like to list more than 4, please attach a Word document with the same information for additional sites. Form C is a budget summary, and Form D is the budget detail. These forms should be submitted along with your proposal. So what should be in your proposal's project overview? We'll talk about that some more here. Again, we're looking for what is the purpose of your project. Please describe the project activities, how specific goals will be achieved, how your outreach links to enrollment through MNsure. You can describe the sequences, flows, and interrelationships of those activities you're proposing, and also talk about your planned staffing. What should that project overview convey? We're, of course, looking for some enthusiasm about MNsure and this new opportunity and the innovation that you're proposing in your project overview. Also, we're looking to find out potential impact. We'd like to know a detailed summary of the project strategy and assurance that the project and work can be completed as described. Again, I'll refer to an earlier comment I made about information about uninsured being available soon. We're hoping to post that in the next week or two to our website for those interested in using that information in their proposal. MNsure is also looking for this information in proposals. We're looking for an explanation of your organization or coalition's experience. Please talk about the existing relationships that you have with the populations you'll be serving. In describing those populations and geographic areas, please include a projected number of individuals to be served and enrolled through MNsure. We'd also like to see you talk about engagement strategies. How will your project incorporate outreach and enrollment activities? We'd like you to demonstrate the correlation between those outreach activities and successful enrollment through MNsure. Proposals should also include budgets that match the proposed efforts. This is a quick highlight of that budget detail that we're looking for. In direct costs, we're looking for salary information about staffing, supplies, and travel directly related to the services you'll provide. There's also allowable costs, small equipment, and technology related to this work, including kiosks, if your project would include such information, as well as laptops. All right. So how will proposals be evaluated? MNsure has a review process in place. First, we'll review for completion and compliance with the eligibility upon receipt. That means we'll be looking to make sure the forms are included and all the pieces of the proposal that are required are in place. We'll also be looking to make sure that your organization is an eligible type of organization. We'll then have a merit review. As described in the RFP, there's a 100-point scale to evaluate selection criteria. We'll be looking at the geographic areas being served. MNsure wants to ensure that we fund statewide coverage for this work. We're looking at experience in the engagement approach in the proposal and for any innovation you propose in your project overview. Also, we'll be doing a financial review to make sure that the proposed budget complies with MNsure policies and procedures, and that it's reasonable and clear and justifiable to the project. MNsure is going to carefully consider proposals in the context of our strategies and goals for education in Minnesota. We're offering statewide in-person consumer assistance and linking outreach directly to application enrollment and enrollment assistance. Here's the timeline again. You'll notice it matches the timeline for the applications as well. Solicitation was published on May 28th. Grant proposals are due July 19th. We're looking to formalize awards on August 23rd, and training will take place in August and September in preparation for October 1st. Now I'd like to talk a little bit about frequently asked questions. We've got our email address available on our website for you to submit questions. We'll also be taking the questions we get in chat today and answering those that we can. We'll be posting our frequently asked questions on a regular basis throughout the solicitation period up until July 19th. This is just an example of some of the frequently asked questions we've already received and the answers we've provided. They're posted to our website early this week, and you'll notice that they're denoted with a date in front of the question, so you can see on a weekly basis or on a regular basis which are the new answered questions. This is where we'll also be posting answers that we can't provide to the questions we received today during the chat Q&A. And now, we'll open the webinar up to the questions we've already received and those that we continue to receive.
Thanks, David. We have been diligently recording the chat and logging the questions that you received. We've already received probably 6 pages of questions. We will try to address as many as we can in the remaining time, but do keep in mind that the MNsure staff will be answering questions and posting them on the MNsure website. So David, the first question. Where can I find a list of organizations who will be participating in the MNsure program for navigators and assisters?
Good question. That information won't be available until we've finalized our partnerships. We will be, there should be a directory available on our website as of 10/1 where consumers can find certified navigators, in-person assisters to help them with application and enrollment.
If a person is currently satisfying a pre-existing limitation, will this be removed as of January 1st of 2014?
I think the question may have to do with pre-existing conditions, which previously could prevent you from enrolling in a health plan. That pre-existing condition requirement will go away effective January 1st. And that includes this open enrollment period beginning October. You should not be denied coverage if you apply during this open enrollment period beginning October 1st. For those of you also already enrolled in through MCHA or MCHA, that program is currently working with the Department of Commerce on a transition plan and communicating to those enrolled to ensure that the information is available for those interested in going through MNsure to get coverage in this new open enrollment period.
Will Medicare supplements eventually be on the healthcare exchange? If so, when?
Not now, and I'll have to take that back to answer later on.
Does an assister provide insurance advice?
No. There's a clear distinction between the role of an agent broker and a consumer assister. In fact, we posted this week some guidance on that. It was a partnered bulletin between MNsure and the Department of Commerce, which explains the difference between the services that will be provided between navigators and brokers. We'll also be working on that in our training. In addition to this information, we'll be training on the distinctions and where referrals need to take place.
David, what is the length or duration of training for navigators and in-person assisters? And what is the timeline in which this training will begin?
We're still working on the details. We're currently developing the training, and we don't know yet how long it will take. We do know that it will be web-based and accessible after the certification period. We're hoping and working really hard towards making the training available beginning October 1st. Since we're still doing a lot of the work to get MNsure up and running, the training is going to likely be in a phased approach, but we do hope to begin as soon as possible after formalizing our partnerships.
Will current MNCA be navigators or in-person assisters, and can one person be considered both a navigator and an in-person assister?
That's a good question. We, in fact, have our a MNCA staff member with us today to help answer these types of questions. I'll let Jennifer go first and then follow up if needed.
Hi, this is Jennifer Ditlefson with the Department of Human Services. MNCA organizational contracts will be ending, so organizations that wish to be a consumer assister will need to submit the consumer assistance application.
Yep, and so we'd be looking to those current MNCA partners to be completing the applications and becoming navigators, in-person assisters, or certified application counselors. We'll also, MNsure, will be working closely with that MNCA team at DHS. And that resource center shouldn't be going away. We'll continue to work with you, should not be going away, And we'll continue to work with those experienced partners as navigators and in-person assisters.
Are navigators and in-person assisters working with the same population?
That's a good question. I think it's really up to the organizations providing the work. We look to you to serve the communities you currently serve or are interested in serving. The distinction really comes down to that compensation. So whether you anticipate serving, 90% of your consumers you're working with might be eligible for Medicaid or Minnesota Care, that 10% might still fall into the eligibility for a QHP along with APTC CSR. That's the tax credits available through MNsure. So we'd encourage you to play both roles. You're going to be providing the same services to individuals regardless, and that way, whatever the enrollment ends up being, you'll receive compensation for your work.
What is the difference between a navigator and an in-person assister? If I'm both, do I get compensation through both programs for one application?
That's another good question and a fine distinction. You don't get paid twice for the same work. Now, you may have a household that you're working with where maybe the parents are eligible for a QHP and the children might be eligible for a public program. If there's 2 adults in the household and 2 children, and the 2 adults are in a QHP, you might get compensation through the in-person assister program for the adults once you've completed that application and they've completed enrollment, and then compensation through the navigator program for the enrollment of the children.
Will counties administering medical assistance also be assisters and navigators or not, since they will be receiving 75% reimbursement for MNsure activities?
That's a great question. Counties can be in-person assisters, and we're looking at counties to do so. We're encouraging them, in fact, to play the role, as they're likely to see clients that may become eligible or be eligible for a QHP and APTC. We will say, though, that county human service agencies that do get that Medicaid reimbursement are not eligible to be navigators. I'm looking to Jennifer over at the MNCA team to clarify if there needs to be. That's correct. Okay. Hope that clarifies.
In addition to calling the contact center, can I email, instant message, text? Essentially, my question is there more than one way to communicate?
That's a great question. We've talked a lot about that. I haven't had a whole lot of insight into that yet. I know they're working hard at it, and so we'll take that one away and post an answer to that. I think, like we've been saying, the details of MNsure are still being worked through, so I'm not sure where that's landed at this point.
David, in the 3 scenarios that you presented, who gets paid for the enrollment in each of the scenarios?
That's a good question. Each individual we're going to build it so you can be linked to one of each type. So an individual could have a certified application counselor and a navigator IPA and a broker. That way, if all 3 types of assisters help an individual or household, each of those assisters would get compensated for their work.
What should an assister do when a person asks them which plan they should select?
Well, we're looking for, and I'm not going to look towards the unbiased opinions, right? So we're looking for consumer assisters to use the tools available on MNsure to explain the options available to individuals. They're not there to make that selection for the individual, and not there to tell them which plan works best for them. They're really there to explain their options, and if they're looking for that additional level of help, they can refer the individual to a broker.
Is being a navigator or in-person assister a competitive process, or is it that whoever wants to receive the training and certification just needs to fill out the application?
We're just looking for you to fill out the application. If you meet all those minimum requirements and fully complete the application and are an eligible type of organization, we'll be looking to partner with you as a consumer assistance partner.
Is it a must if you're going to take on the service to hire all categories, that is, navigators, assisters, and counselors?
I guess I'm not quite sure what that question's getting at, but I would say that organizations really would be one type. So you could be a navigator and in-person assister. That way you're doing this work and being compensated for it. Or you could be a certified application counselor organization. It's really those two types.
Do you have statistics on uninsured individuals by economic regions in the state or other statistics, including race, age, or other demographics, to help inform prospective consumer assistant partners on where the greatest needs are? And will you be awarding grants according to those needs?
Great questions. We have been working with our partners at the University of Minnesota, SHADAC, on getting some of this information ready and available to post on our website. We'd hoped to do it last week, of course, but as everything, we're getting it to it as quickly as we can, so we hope to post some of that information on our website soon. To the question, will we be awarding the grants according to these needs? Yes and no. We do want statewide coverage, and we want to ensure that those areas of highest need do have enough resources. But it doesn't mean we're going to tie it directly to the numbers. So we're not looking for the proposals to make sure we get all those numbers or anything like that. It's just more of a general sense of where are the highest levels of need and ensuring that within that statewide coverage we have some extra coverage around those areas.
Can a nonprofit be both in a collaborative coalition in one county and then submit a combined outreach and assister grant in other areas?
I would say that gets back to the one proposal per organization. Your organization could certainly be a navigator, in-person assister, and serve several counties, and then be a part of a coalition that serves only one of those counties. But we wouldn't expect that organizations could be parts of multiple coalitions serving multiple geographic areas.
Can an organization become a navigator or in-person assister without applying for a grant? And is there any cost to being trained?
Great questions. You do not have to apply for a grant to be a navigator or IPA. If you'd like to just play the navigator IPA role, you can complete that application and you'll receive training to become certified at no cost to the organization.
Do collaborations have to get approval to submit a proposal, since the RFP states consideration may be made for requests up to $500,000?
No pre-approval is required. If you're submitting a collaborative proposal, simply submit as outlined in the RFP.
Will applications for MNsure, medical assistance, and MNcare be submitted online, or are they being submitted on paper?
That's a really good question. MNsure is being built so that consumers can apply through our website. There will remain, a paper application will remain available, but we're going to encourage everybody to use the online portal for application.
What's your definition of coalition?
That's a good question. Looking over it, it should be outlined in the RFP, and so it's in there, and we'll get back to that question and repost that wording right in the FAQ.
Can an organization apply for both the grant and the Consumer Assistance Network without being eliminated for both?
Definitely. Great question. You can submit your application to become a consumer assistance partner, and it has nothing to do with the grant. We're going to be looking at those separately. If you apply for the grant and you want infrastructure funds in addition to outreach funds, you do have to have had submitted an in-person assistance application, because the infrastructure portion of those funds are tied to that role. But you don't have to do an outreach grant to be a Navigator, In-Person Assister, or Certified Application Counselor.
Now, David, there are a whole range of questions that are very similar in nature, and so here is some information that might be helpful for y'all to consider as you look at the questions that you've asked.
Yeah. Okay, so there's been some questions we've received through our inbox in the past few weeks about liability and E&O insurance. And we are going to post about that this week and respond to those questions in our FAQ this week. What we're not going to do through our inbox is address eligibility and policy questions. That goes for today as well. This is about consumer assistance partners and working with organizations to provide consumer assistance services. Those types of questions, if you have them, you can email our public comments email at MNsure, and you should receive a response quickly. Good question here, or good point, is the in-person assisters do not need to perform their work in person necessarily. It's a name that was used in federal regulations and guidance. It's really about the funding piece, both navigators and in-person assisters, and even certified application counselors. We'd expect to provide their services in any way that they can, whether it's in person, by phone, email, follow-ups, whatever that is. To be a navigator or in-person assister or certified application counselor, we'd like to emphasize that you please complete and submit the application. The notice of intent is for agents and brokers. If you'd like to play one of these three consumer assistance partner roles, the navigator and or in-person assister, certified application counselor, we're asking that you complete that application, which is a fillable PDF on our website. And along with that, again, agents and brokers should submit a notice of intent, which is really just an email to MNsure letting us know that you're interested. It's non-binding, and we'll be following up to those that submit that notice with more information about the agent-broker role. All right, and then just to emphasize again, the navigators and in-person assisters and agents brokers are going to be listed in a directory on our website for consumers to find someone to help them when they need help. And the expectation of all those partners is that whoever calls you, if they look you up on our directory, if they call you, our expectation is that you'll be providing them assistance. We will certainly have more detail on that business process and the referral process of the consumer to the assister. We'll cover that in training and certainly have resources available to partners as we get into the fall open enrollment.
Great, David. I think that was some good information to handle a lot of the questions that have come in that were very similar. We'll go back to the more specific questions. Can an individual be a navigator or in-person assister, and if the person doesn't have an organizational affiliation at this time, but they have the intent to have an organizational affiliation in the future?
That's a really good question. We've had that several times, and we know there are many individuals interested in helping out here and helping their communities. I would say, well, one, you have to be an organization to become an in-person or to become a consumer assistance partner. And if you're not currently associated with an organization, you could certainly find one to work with, find one to volunteer with. I'd expect that some of these partners are going to have a volunteer workforce. Or you could look at creating your own organization. That could be perhaps a one-person organization, and I'll leave it at that.
As a broker, I have submitted the letter of intent, but what happens next? Do I also fill out the application?
We just clarified that a bit. So if you're a broker and you've sent in your letter of intent, that's great. We appreciate your interest in selling in this marketplace. We continue to receive a lot of those notices. You do not need to fill out an application. We're looking to get a communication out as soon as we can. As I've said throughout the webinar, we're still working on a lot of operational details and about how this will work, and want to be sure we communicate the right information when we do respond to all those notices of intent, because we want to be able to inform our agent and broker partners of the process as clearly as we can, just as we are in this webinar for the consumer assistance partners.
The MNCA contracts in on June 30th. Is there a gap between that date and the start of MNsure? Good
question. I do know that those contracts actually end in 2014, but if Jen wants to say anything else into that. Nope. So the end date is actually June 30th, 2014. And those current MNCA partners should be receiving a communication at some point this summer from DHS explaining the transition, because we do know there will have to be a clear transition from that role to this new role.
Can you please describe the communication approach more fully between the outreach and infrastructure grants?
Another good question. We are still, that's some of the detail we're still working on at MNsure. Our marketing and communications and outreach team is working hard on a plan. And what we're looking for in the grants are proposals and project overviews that talk about how your organization or coalition will serve your communities in the way you know how, with your expertise and your knowledge and knowledge about the communities you serve. We're looking for you to provide innovative solutions to doing this outreach and making sure that Minnesotans know about MNsure and how to apply through it and enroll through it. What we then plan to do really is use our plans from MNsure for communications and marketing and outreach to really supplement and complement the grants that we have with our community partners.
David, is there a deadline on the letter of intent for producers?
Good question. I'll try to address that for both the notice of intent and the application. For the notice of intent for agents and brokers, there is no deadline. It's an open-ended notice of intent. We may later in the summer be setting a date to say we need notices by this date so that we can have you certified and trained by 10/1, but at this point we don't have a deadline like that, so open-ended. For the applications as well to become navigators, in-person assisters, or certified application counselors, that July 19 deadline is for 10/1. If your organization wants to begin providing consumer assistance services on October 1st for the first part of our open enrollment at MNsure, we'd like you to submit your application by July 19th. But we'll continue to receive those applications after that date and ongoing. There will be future open enrollments, and we may even bring on more partners throughout the open enrollment period. But the July 19th deadline is really only for October 1 services, and with the notice of intent for agent brokers, there is no deadline.
If counties want to have in-person assister programs, do they need to apply in the same way? That is the process that's been presented here?
That's a good point to clarify. If a county is interested in becoming an in-person assister, we are asking that the county submit an application, the fillable PDF here that the nonprofits are using, to indicate to MNsure that they would like to play the in-person assister role.
What is the definition of a QHP as opposed to a public program?
Good question. I'll try to clarify as best I can, but again, this to me lies in a policy question a bit, so look to our website for a lot of information about this, and of course for our consumer assistance partners, we'll be training on this throughout the summer. A QHP stands for a Qualified Health Plan, and really what that is private plans offered by insurance carriers in Minnesota that will be available through MNsure. Those are private healthcare insurance plans that you can enroll in through MNsure, and then by applying through MNsure, consumers can apply for tax credits, which could help cover the cost of enrolling in the QHP. Opposed to the public programs, which are Medicaid and Minnesota Care and others, those you can also apply to through MNsure, but are not considered a QHP. And again, I'll just say, check our website for clear information about that. I'm not a policy expert in that area, and so don't want to misspeak.
If the outreach and infrastructure grant applications are due on July 19th, but we haven't yet heard our results on our consumer assistance partner application, can we still apply for a grant?
Yeah, that's a good question. I think that goes to the July 19th not being the hard deadline for the applications for consumer assistance partners. So we'd actually encourage you to do both at the same time. They're not separate things. You know, we look for all interested organizations to submit that In-Person Assister Navigator application to play that role. And in addition to that, you can complete a grant proposal for additional funding to both build infrastructure to do that work or supplement the work with outreach.
Are coalitions eligible for the maximum grant award of $500,000, or is it just regions that are eligible for this amount?
Interesting question. It's the coalitions that are eligible for up to $500,000, and I think the intent, the wording on there is to say the coalitions were looking to cover a region or the state. Yeah, that clarifies.
Can you say more about the required service of providing referrals? Is this referrals to clinics or beyond that?
Another good question. You know, we talk a lot about referrals. We are actually working on process flows and operationalizing all this and thinking through how this is going to work. We're obviously going to have procedures for our contact center to refer to our partners and some information for our partners, and when they refer to the contact center or other consumer assistance partners, we also hope to have information available for those other types of referrals if they need assistance outside of applying and enrolling in health insurance. Expectation would be that those resources are available for the referrals, that we will provide more information and clarity as we go through the summer, and that in training we'll really get into the detail on how all this is going to work.
Great. An organization that primarily helps people get on medical assistance, can they apply to be both a Navigator and an In-Person Assister? But it wouldn't make sense for them to go for the In-Person Assister outreach grant, would it?
Well, what I'd say is, I think I mentioned this earlier, you know, if your organization serves a lot of folks that are potentially eligible for public programs, we would still encourage you to apply to become an IPA as well as a Navigator. That way, those that maybe are eligible for QHP, you would get compensated for that work no matter what, as well as if in order to apply for the infrastructure funds through the grant opportunity, you do have to be an IPA. So if you're looking to, for instance, purchase a laptop to do some of this outreach or to do some of this consumer assistance and application enrollment assistance, you can apply to purchase that laptop through the infrastructure grant opportunity but to do so, you do have to be an IPA.
Can you clarify whether assistance partners will be considered IPAs or navigators when assisting folks who end up enrolled in Minnesota Care?
Great question. We're still working on that, so I'm going to say that's to be determined. As a lot of you may know, the Minnesota Care piece is a moving target. The state's working hard on that to figure out what that's going to look like in October, and so we should be providing more details soon, but we would expect that that's going to fall right in to the services of both types. That's why we are encouraging entities to become both navigators and IPAs. That way, no matter what program, whether it's Medicaid or medical assistance or Minnesota Care or a QHP, that way you're compensated for the work you're doing with the consumer.
Where can I find the MNsure referral guidance that's referred to in the RFP?
That's in process. I was just mentioning that. We're going to be covering that in training and a lot more information about that to come. And at that point, that's the most information I can give you.
Will navigators or in-person assisters have an obligation to follow through with clients on the application, like is expected in the MNCA program?
Yeah. At minimum, we'd like you to do that if it occurs. The goal with MNsure really is for that not to happen. It's a real-time determination, and so a lot of that work's going to go away, but it will continue, and we acknowledge that, and that's an expectation that work will continue.
Can you provide examples of what infrastructure needs we might need to facilitate and support the application and enrollment assistance activities?
Another good question. I think the technology is a key piece there. Like we were talking about, there could be application and enrollment assistance can take place both in person, by phone, maybe at the entity's offices, or maybe out in folks' homes. It's really about making sure you serve the community the way the community needs to be served. So in order to do that, we realize organizations may need laptops, cell phones, any other piece of technology that will help them do that work, to go out and work in their communities. Another idea I've heard floated around is kiosks. If you're looking as part of your grant to set up a site for individuals to come and fill out applications and enroll with some assistance, that would be wonderful. That would be a great thing, I think, if we saw some sites pop up around the state operated by consumer assistance partners where people could go get help.
Can you be a for-profit company and partner with MNsure?
Yep. You can go ahead and apply. We are going to be taking into consideration in the review process any potential conflicts of interest with where that compensation is coming from. But we are accepting all types of organizations, applications, and apply if you're interested, and we'll go through that process with you.
Can an insurance agency partner with an in-person assister or navigator?
Yes, that's a bit what we're talking about with the referrals. And then as well in the RFP we talked about coalitions. We're hoping to see some of that as well, of different types of assisters, from navigators to brokers, working together to figure out how this is going to work in this new marketplace. It's really a new landscape. This is new to all of us. So it'd be really neat to see this network develop together and some innovative ideas from all those entities out there doing this work now.
Can different coalition partners cover the same geography but different ethnic communities?
Yeah, I would think so. Yeah, that would be a good proposal.
And then one last question. One last question, which was, will this information be available in other formats? And so just to reiterate something that we mentioned at the beginning of the webinar and a couple of times via chat, is this webinar is being recorded. Both the audio and the slides are being recorded, and we will be posting those to YouTube in the coming days. The slides themselves will also be posted to the MNsure website. In addition, we have been recording the questions as they have been coming in, and the MNsure staff will be answering those questions and posting the answers online for you. You should continue to monitor the MNsure website to look for all of this information, and I highly recommend that you sign up for the email alerts that MNsure is sending out on their website. I've signed up for that several weeks ago, and it's been very helpful to keep an eye on the as MNsure makes decisions to stay informed on the process. If you have additional questions, you can see on the screen they have set up a special email account to take questions about the Consumer Assistance Program. That's mnsure@state.mn.us. And I just want to let you know that all registered participants for this call will receive an email when the materials go up on YouTube and the web. So as soon as this recording is available on YouTube, you can count on getting an email from the Council of Nonprofits to let you know that the recording is available. David, do you have any additional comments you would like to say as we get ready to wrap up this webinar?
I think I'd just like to say thank you to MCN and Sandra for hosting. This was a great opportunity to reach out to all our potential partners, and thank you everybody who had the interest and time to spend with us today on the webinar.
So on behalf of the Minnesota Council of Nonprofits, I would like to thank MNsure for presenting this information to the nonprofit sector today, and I would like to thank all of you for participating on the call and wish you the best of luck as you consider this important application. Goodbye.